Dr. Dulcie Wanda. I'm a clinical and radiation oncologist. That means a doctor who treats cancer using chemotherapy and radiotherapy. Today we're going to talk about skin cancer. All of us have skin. It's what covers our body. It's actually said to be the largest organ in the body because it covers every part of our body. It's important for us to know that skin sheds. Like over time, the cells grow, then they die off, and then a new layer forms. And that's a continuous process where some of the cells are dying off and others are growing. But it is a seamless process such that you maintain the same consistency, the same feel. However, there are times when that process is hampered, when it stops working well. For example, if you're exposed to UV radiation, like we know the ozone layer is not working as it should be, so ultraviolet rays are coming down. So when your skin is exposed to ultraviolet rays, then it does not work well. So you find certain cells grow faster and don't die off as fast, and you find maybe thickening of the skin, ulceration and ulcer forming, and those could be signs that skin cancer is happening. So it's very important to know that skin cancer can happen, especially in sun exposed areas. Most of the time, you find cancer of the skin is more common in women up to almost the age of 50. After the age of 50, then it becomes more common in men. Most of the places you notice cancer would happen is in the sun exposed regions, just like for the reason I've mentioned. So, places, if you wear short sleeves, then the places that would be exposed to the sun would be at risk. So, if you work long hours in the sun, then it's a risk factor for getting skin cancer. The lighter you are, the higher the skin. So I think in Kenya they have something saying kutoa tint. So if you have removed your natural skin color and you've lightened your skin, you've removed what are called melanocytes, the ones that make the skin dark. So absence of melanin, the darkening pigment of skin, is a risk factor. For those who are white and have freckles, have blue eyes and blonde hair, then those are more reasons because they have even fewer melanocytes than those whose skin is much darker. If you have a mole is like a swelling or a change in the body. And we'll talk about what do you look out for in those swellings to know whether it's a risk factor or not. If you've had a family history of cancer, then that's also a risk factor. So if someone in your family has had cancer in the past, then we are looking at you cleanly. If you have skin that easily gets sunburned, like if you go to the sun and you get sunburns, then that's a risk factor. So there are different types of skin cancer. We have one that is called basal cell carcinoma. So the skin is divided into different aspects. And at the base of the end of the skin, we have some cells that are called basal cells. And that's where the cancer happens. It's the lowest part of the epidermis, the skin that you see on the top, the lowest aspect of it. Then we have something called squamous cell carcinoma, the outer layer of your skin that has squamous cells. And then we have melanoma. Remember, we've talked about melanocytes. So melanocytes are a certain type of cells that have the dark pigmentation. So you'd find a lesion that is black in color would form and eventually grow over time. There are other types of cancer like Kaposi's sarcoma, it's a skin cancer. We have Merkel cell carcinoma. We have sebaceous gland carcinoma. And those are really terms that tell us. And there's another one also that's very mouthful, dermatofibrosarcoma protuberans. So that's also something that can happen in skin. But the ones I've talked about, the basal cell, the squamous cell, are more common, and the melanoma and also Kaposi's sarcoma is common, both endemic and non-endemic. The one that is HIV associated and another is non-HIV associated. Those are common that we see here. If we compare our statistics to the US, then you find our statistics are lower. Remember we mentioned the lighter you are, the less the melanin, the higher the chances. And you find most people in this part of the country are dark, meaning that helps them. However, the downside of being dark is that those early symptoms are not easy to see. So that means in our population, skin cancer is caught late, having been quite advanced, meaning the treatment options are a challenge. The outcomes are not as good. The symptoms. If you have perhaps a swelling, you've had this swelling since you were born, there is A, B, C, D, E that you need to look out for. One, asymmetry. A mole, if it is symmetrical, it's a good thing. If it stops being symmetrical, if you divide it by 2 and this side doesn't look like this side, it's something of worth focusing. 2, we're talking about border. If the border of that swelling is irregular or blurry, it's not a clear border, then that's a risk factor. The other thing is the color. If that swelling has more than one color, different color patches, it's a risk factor. The other thing is the diameter. If it is greater than 6 millimeters, then we want to observe that mole further. And E is the evolution. If it is changing in size, changing in color, changing in thickness, it has had a change, then that is a suspicious mole. And it's important for it to be looked at by a doctor. Most of the skin lesions would be presented to a dermatologist. A dermatologist is a consultant who specializes in skin care. And what they would do is either take scrapings or take a tissue biopsy of that mole to be able to send to the pathologist so that we can look under the microscope and see are there cancerous cells or not. The treatment is dependent on which size of the lesion and how extensive it is. So for a very small lesion, it's very easy to have a surgical resection. You remove it. For those lesions that are extensive, that are perhaps invaded and metastasized, then we can use chemotherapy. And in some rare cases, we can use targeted therapy if there is a targetable mutation in the cancer that is there. We can also use radiotherapy to be able to radiate the cancer cells and shrink the tumor. So there are many treatment modalities. So we've talked about age being a risk factor. We've talked about sun exposure. We've talked about being light-skinned. We've talked about also if you have skin that is easily sunburnt. If you've removed melanin, like you have bleached your skin, then it's a risk factor. And also being an albino. As we well know, albinos don't have melanin, so their skin is really prone to getting cancerous lesions. And that is why it is highly recommended to wear sunscreen. To ensure we're wearing long sleeved if we have to work in the sun, to ensure we are reducing the number of hours we are using in the sun. And that will go a long way in ensuring we are reducing the chances of skin cancer. So sun exposure, ensuring we wear sunscreen is very important. Wearing of hats when you're in the sun can also protect the sun exposed areas. And then it's very important to avoid going for tanning. So there are people who want to tan, especially the whites. There is a lot of talk and appreciation of when the skin is suntanned. So people developed what is called a tanning bed, where you enter and you're inside the tanning bed. And it has been shown to have a high risk of causing skin cancer. So it's very important for us to do that. It is important for us to look at our skin. Know what is normal. And if you have a swelling that has always been there, then remember the ABCDE, where we're looking at what is the size, we're looking at the color, we're looking at the borders, we're looking at the diameter, and even the evolution. These are important things to look out. If any of them are changing out of the ABCDE, it is important to see a dermatologist for a biopsy to be taken and eventually treatment started for that.